So, Dr. Crawford, how do drugs for overactive bladder actually work? It's a good question, and you should get used to asking these kinds of questions before you start taking drugs your doctor prescribes. Basically, there's two categories of overactive bladder drugs. The first, the oldest category, are called anticholinergics, and they all kind of work the same way. They bind to the parasympathetic receptors on the bladder and tend to block those receptors from becoming activated such that your bladder doesn't contract as much as it otherwise would. But these drugs also bind to similar receptors in your salivary glands and in your gut, can cause dry mouth and constipation. And some of these drugs can even cross the blood-brain barrier and make us more dim-witted than we otherwise would be. That's not good. So talk to your doctor about that possibility as well. So these drugs are, there's a whole bunch of them now. Oxybutynin, which is ditropan, and tolterodine, which is Detrol, and darafenacin, which is Enablex, solifenacin, which is Vesicare. And there's others as well. And like I said, they work kind of the same way, but there are some variations in terms of how readily they cross the blood-brain barrier and also bind your salivary glands in the gut, parasympathetics as well.